Welcome to Module 3, Using Inhalers. In this module, you will learn how to use different types of inhalers, what a spacer is, and how to take care of your inhalers. There are two different types of medicines that are used to manage asthma: controller medicine and rescue medicine. Inhalers are the devices that deliver the medicine through your mouth and into your lungs. Two types of inhalers are the metered dose inhaler, or MDI, and the dry powder inhaler, or DPI. Using this spacer helps to deliver the medicine from certain metered dose inhalers, or MDI, more effectively into the lungs. Proper technique is important when using either an MDI or a dry powder inhaler, DPI. A spacer, or holding chamber, is a device that attaches to a metered dose inhaler, or MDI. It makes using an MDI easier because the spacer briefly holds the suspended medicine mist until you breathe it in. Without the spacer, more medicine would be absorbed in your mouth instead of being delivered to your lungs. If you're supposed to use a spacer with your medicine, make sure to use it with each of your MDIs every time you use one. Swish and spit with water after taking your inhaled medicine. A spacer, or holding chamber, is not necessary with the DPI. Medicine is automatically inhaled when a breath is taken. To use a metered dose inhaler, or MDI, with a spacer, you should follow these instructions. Stand up or sit up straight. Shake the MDI a few times to mix the medicine. Attach the MDI to the spacer. Breathe out completely. Place the spacer in your mouth and close your mouth tightly around it. Press the MDI to release one puff of medicine into the spacer. Breathe in slowly and deeply. Hold your breath for a count of 7. If you're supposed to take a second dose, wait 1 minute and then repeat. To keep the spacer clean, wash it with soap and water, rinse well, and let it dry on a clean towel. Next, we're going to watch a video from the American Lung Association. This video shows how to use a metered dose inhaler.
How to use a metered dose inhaler with a valved holding chamber, also commonly referred to as a spacer. Check the dose counter on the inhaler. Do not use it if it says 0. 0 means the inhaler is empty and needs to be replaced. Prime a brand new inhaler before using it for the first time. This prepares the inhaler for use. Prime the inhaler by shaking it for 10 seconds and spraying 2 or 4 puffs into the air based on your medicine instructions. Prime again if you have not used this inhaler for 1 to 2 weeks or have dropped it. Priming does not waste doses. To take a dose, shake the inhaler to mix the medicine. Take the cap off the inhaler and make sure the mouthpiece and valved holding chamber are clean and there's nothing inside the mouthpieces. Place the inhaler mouthpiece into the open end of the valved holding chamber. Remove the valved holding chamber mouthpiece cap. Prepare your body by sitting or standing up straight. Breathe out all the way, away from the holding chamber. Hold the inhaler with your pointer finger on the top of the inhaler and thumb on the bottom. Tilt head back slightly. Put the mouthpiece of the holding chamber into your mouth above your tongue. Close your lips tightly around the mouthpiece. Press down on the top of the inhaler once to release the medicine and begin to breathe in through your mouth. Keep your lips closed around the mouthpiece. Breathe in for 3 to 5 seconds using one deep and steady breath to pull the medicine into your lungs. If the holding chamber whistles, you are breathing in too fast. Remove the chamber from your mouth and hold your breath for up to 10 seconds. Breathe out slowly through your mouth. Repeat these steps in 1 minute if using more than 1 puff. Rinse your mouth with water and spit it out. Replace the cap and store in a cool, dry place. Clean your inhaler, chamber, or spacer according to their package instructions. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.
To use a dry powder inhaler, or DPI, you should follow these instructions. Stand up or sit up straight. Make sure the disc is label side up and held level, otherwise the medicine falls off. Click the disc or wheel as instructed to prepare for the next dose of medicine. Breathe out. Place the mouthpiece in your mouth with lips sealed around it. Breathe in deeply and forcefully. Hold your breath for a count of 7. If you're supposed to take a second puff, wait 1 minute and then repeat. A spacer or holding chamber is not necessary with a DPI. Medicine is automatically inhaled when a breath is taken. Swish and spit with water after taking your inhaled medicine. Next, we're going to watch a video from the American Lung Association. This video shows how to use a dry powder inhaler.
How to use a discus dry powder inhaler. Check the dose counter on the side of the inhaler. Do not use if it says 0. 0 means the inhaler is empty and needs to be replaced. With one hand, hold the discus in a level, flat position. With the other hand, place your thumb on the thumb grip. Push your thumb away from you until it clicks. You should now see the mouthpiece. While holding the device in a level, flat position, use your thumb again to push the dose lever away from the mouthpiece as far as it will go until you hear it click. Prepare your body by sitting or standing up straight. Breathe out all the way away from the inhaler. Never breathe into the device. Tilt your head back slightly. Put the mouthpiece into your mouth between your teeth. Close your lips tightly around the mouthpiece. Breathe in quickly and deeply through your mouth. Remove discus from your mouth and hold your breath for up to 10 seconds. Breathe out slowly away from the device. Rinse your mouth out with water and spit it out. Close inhaler cover until it clicks and store in a cool, dry place. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.
It's important to take good care of inhalers so they work properly. They should not be stored in hot cars or other hot places. If an inhaler has expired, the device should be thrown away. It's helpful to keep your inhalers in their original cases so they don't get mixed up. They should also be in one place with your asthma action plan for easy access. This will help you or others know how to take your asthma medicine the right way depending on the symptoms you have. Key points from this module are: there are different types of inhalers for different types of asthma medicines. You or your child should use a spacer with your metered dose inhaler. It's important to use your inhalers the right way so that you get all the medicine you need to help control your asthma. Take good care of your inhalers so they work the right way.